Here's your multiplication test. Jonathan, are you getting frustrated?
Well, a little bit. I don't know what's wrong. Just having trouble.
Okay, well, why don't we do this? Let's take this multiplication test during recess,
Okay.
and I'll give it to you orally.
Well, what's orally mean?
That means I'll ask you the problem and you give me the answer, and I'll write it down for you.
Okay, we can do that. That
Okay.
sounds good to me. And then Hi, Miss Connor.
Hello, Jonathan. We're going to use our recess time to take our multiplication exam,
Okay.
our multiplication test. So I'm going to ask you the problem, and then you just tell me the answer, okay?
Okay.
Okay, what's 1 times 3?
3,
2 times 2?
4,
12 times 12?
have we gone over that one? That's 144.
Okay.
Yeah, that's good.
Other health impairments are acute or chronic health problems that limit strength, vitality, and alertness.
Some of these impairments include ADD, ADHD, diabetes, epilepsy, heart conditions, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and even Tourette syndrome.
There are 2 systems of help that are available immediately to help eligible children with other health impairments. These divide out by age as follows.
Early intervention services for children 3 and under, and special education and related services for children from age 3 to 21, sometimes older. These services evaluate the child, identify the OHI, the other health impairment, and provide an individual family service plan, as well as provide a wide range of individual instruction to meet the unique needs of the child with the other health impairment.
For life at school, medical, school health, and school nurse services are available. States and local school districts often have guidelines that address school health services and school nurse services. These may include providing such health-related support as special feedings, clean intermittent catheterization, suctioning, the management of a tracheostomy, administering and dispensing medications, planning for the safety of a child in school, ensuring that care is given while at school and at school functions to prevent injury, such as changing a child's position frequently to prevent pressure sores, chronic disease management, and conducting and or promoting education and skills training for all, including the child, who serve as caregivers in the school setting. Determining what related services a child needs is the responsibility of the child's IEP team, which is the group that develops the child's individualized education program.
It's not uncommon for a child with an OHI or another health impairment to have periodic absences from school, sometimes even lengthy ones, especially if hospitalization is necessary for whatever reason. During these times, the public school remains responsible for providing educational and related services to the eligible child with OHI. Because IDEA specifically states that special education can be provided in a range of settings, including the home or the hospital. States and school districts will have policies and approaches for addressing children's individualized needs and circumstances.
After a child has been out of school for an extended period of time, it's important for parents and school staff to plan carefully for his or her return to that setting and the activities that go on there. However, it's important to understand that planning for a child's transition isn't just about when he or she returns to school. It needs to include moves from hospital to home, home to school to school, hospital to school, school to work or college, and from pediatric to adult health care.
We try to be there for these students throughout their entire age, their entire school life, as like whenever they grow up and as they go through adolescence. So in conclusion, we hope that most of the teachers can take this information and it will help them to be more successful in the special education world.